I'm alive today because of Community Healthcare Network.
Good morning, Cats Health Center. How may I help you?
My experience from Community Healthcare Network started 20 years ago. I was in a situation where I was being severely battered by an individual that I was in a relationship with. I am also what we would call an undocumented immigrant. I left the environment that I was in. I had a newborn baby. She was 9 months old. I wrapped her in a blanket and I just started riding the trains. I saw an ad on the train, on this number 2 train, and the ad spoke to me. The ad literally said, if you're a woman who is in a domestic violence situation, if you're being abused, if your partner is using substances, if you're uninsured, if you have no health insurance, you can call this number and we'll give you help.
Community Healthcare Network was founded in 1981 under the leadership of Anna Dunois. The agency started as a family planning provider. It evolved over the years. It was wonderful that we provided family planning and prenatal care, but there was a need to serve the entire community. Our mission is to provide quality, preventative and primary care to communities throughout New York City in medically underserved communities, and we do not turn anyone away. Each of our health centers are very different because they take on the character of the community we serve.
It's a concept which means that it's not just all prescriptions and directions from a doctor. It's a human being that has needs that has to be taken care of, and the earlier they address, the better it is for society.
You know, a lot of people use the word community, but we really don't act like or be a part of the community. CHN understands that, and that's important.
When I walk down the street nearby, I see my patients and they recognize me as being, part of CABS. It just feels like part of the community.
All right, now open up real big for me, okay?
The good thing about coming to a place like Community Healthcare Network is it's multifaceted. They can come to one place and have all of their needs met.
There's dental services, HIV, primary care.
Social workers, psychotherapy.
Counseling service, we have case management.
Adult medicine, OBGYN, mental health, of course, and pediatrics. So very, very full scope practice.
Looking at the entire needs of that individual and their family, that really makes the difference in the health of that family and also in the health of the community.
Because of me sharing my history of what was going on in my life, I was offered to take an HIV test. And within 2 weeks' time, I learned that myself and also to the baby that I had was both positive for HIV.
Community Healthcare Network was involved with HIV and AIDS at the beginning of the epidemic. One of the first sites in New York City to have a program for pregnant women was Community Healthcare Network.
The future of CHN lies in our ability to find ways to improve the care of our patients. That's number one, that we're not satisfied with what we achieved 5 years ago or where we are today, but that we're always constantly moving forward and committed to the excellent outcomes our patients, all our patients, and all the communities we serve deserve.
I'm living with a disease that is stigmatized and discriminated, but I'm alive today because of Community Healthcare Network, because of people caring, because of staff not being judgmental to me, because of staff allowing me to be me. I'm alive today, and I thank Community Healthcare Network.